And finally on the program, in commemoration of the 2024 Universal Health Coverage Day, the Lagos State Health Management Agency hosted a Stakeholders Appreciation and Recognition Awards ceremony to celebrate their contributions, including the media, towards equitable and quality healthcare under the Ilera Eko Social Health Insurance Scheme. And our very own Titilayo Aberewo was one of those honored.
Reducing residents' out-of-pocket expenses for healthcare services is a big task for the Lagos State government, a major concept in the works since the establishment of the State Universal Basic Health Coverage in 2020 called Ilera Eko. 4 years down the line, the State Health Management Agency, which is in charge of the Ilera Eko Health Scheme, is celebrating and rewarding its partners for the success achieved so far with the enrollment of residents for universal health coverage.
It is with great delight and a deep sense of appreciation that I warmly welcome you all to this momentous occasion. This awards and recognition event is to celebrate the dedication and exceptional contributions of our beloved stakeholders and quality champions who have played an instrumental role in advancing universal health coverage in Lagos State. The theme for the Universal Health Coverage Day 2024 is Health, It's on the House, No, It's on the Government. This reflects the pivotal role of government leadership in ensuring that healthcare is equitable and accessible to all. At LASHMA, we are proud to champion this vision through the Ilera Eko scheme, which is making sure no one is left behind in the journey to UHC in Lagos State. You and I will agree that universal health coverage cannot be achieved by the government alone. It requires a collaborative effort involving various stakeholders, both within the public and the private space. We recognize the importance of partnership on this journey, and we are grateful for the support and involvement of each and every one of you. Together, we can create a world where no one is left behind, where access to quality healthcare is not a privilege, but a reality for every individual. Today, we are not just reflecting on the milestones we have achieved, but also recognizing and celebrating the extraordinary individuals and organizations whose efforts have made these successes possible. Over the years, Ilera Eko has grown tremendously, with now over 1 million enrollees and a robust healthcare provider network, ensuring that quality and affordable care is within the reach of every Lagosian. Through initiatives such as the Eko Social Health Alliance, also called EcoSha, we have also worked to address the needs of vulnerable populations, ensuring that no one is indeed left behind. These efforts were further strengthened by the signing of the executive order by His Excellency Governor Babajide Olúṣọlá Sanwo-Olu, which domesticates the NHIA Act and mandates enrollment into Ilera Eko, being the social health insurance plan for all Lagos residents. The achievements we celebrate today are a testament to the unwavering commitment and resilience of you, our stakeholders and quality champions. Your innovative approaches, dedication to the provision of good quality and affordable care, and tireless advocacy have been the backbone of our success, and we are truly grateful for your partnership in this journey. I encourage all our award recipients and nominees to continue serving as ambassadors of UHC for Lagos State. Let us keep the momentum going and inspire others to join us in building a healthier and more equitable Lagos. To our media partners, development partners, and other stakeholders present, your role in amplifying our message remains invaluable. Together, we can achieve our shared goal of ensuring access to quality healthcare for all Lagosians. As we honor your remarkable contributions today, let us remember that these achievements are not just for today, but for the legacy we aim to leave for future generations.
Policymakers and health management organizations commend LASHMA for the effort put in to deliver quality and affordable healthcare services to the people.
USAID has been a strong partner and collaborator with the Lagos State government, investing in several health initiatives across the health sector. Through the local health system sustainability projects, we have been providing technical assistance to the Lagos State Health Management Agency. Our assistance crushed through the demand and supply side activities of LASHMA. Most importantly, we have been providing technical assistance as regards facility expansion through a grant to LASHMA. We have watched LASHMA grow, we have watched LASHMA have very significant results, and we have also watched LASHMA tell our stories to the very high-level delegations, both from UHC and PEPFAR. I want to thank the providers who are in this room. You have been the reason for the success of LASHMA. There cannot be a good demand side if the supply side is not strong. I want to thank the awardees because it shows you understand the business of health insurance. It shows you're treating the awardees well. It shows that you understand what LASHMA wants to do and how you contribute even as private sector providers to universal health coverage. Because it means that for once, profit may not, I use that word very carefully or cautiously, profit may not be your the first outcome you're looking at. It means that you're looking at how to contribute to improving the health indices of the residents of Lagos State. And for that, I say thank you. To other development partners who have been working with LASHMA and other collaborators and stakeholders, I want to say thank you. We can all achieve more together. Universal health coverage is the goal that we're trying to achieve in primary health care. We want a situation in which no man has to pay out of pocket and access to care is easy and affordable. And health insurance is the way to go. A lot has been done, a lot has been said, even in Dr. P.S. Zamba's speech this morning. She talked about all the policies that are in place and what has been done, especially this year already. So much has been done. And it's for us and our citizens, the citizens of Lagos State, to take advantage of all this and ensure that as many people are registered with the health insurance scheme and are able to access care accordingly.
We are a Nigerian-based NGO that support government and other partners and funders to implement high-impact projects across Nigeria. We are currently supporting LASHMA as TA partners to conduct an implementation research to test equitable digital first care. As we all know, LASHMA, they are pace setters in the digital health space when it comes to government, and we are providing support for them on that. We thank everyone here, including LASHMA, all the providers and partners here, for the good work that you've been doing in terms of universal health coverage. And we encourage everyone to not relent as we continue on this journey.
Time for presentation of various awards to outstanding contributors in the health sector.
Presented to Blooming Care Hospital as the outstanding provider-led enrollment hospital.
It was also time for the recognition of the contribution of the media in promoting Ilera Eco Health initiatives, and Channels Television's correspondent Titilayo Abereowo was honored for her exceptional health advocacy reportage. The Permanent Secretary of LASHMA assures of new healthcare initiatives in the year 2025.
We will try to do the public awareness in a way that it speaks to the people more. We feel that up till now, maybe we've been doing it based on our own understanding and not coming really down to the level of the informal sector in terms of grassroots. So we've partnered with Oga Bello, who is a very well-known face within the Yoruba industry and indeed in the theatre arts across Lagos State, to come up with messages that are, indigenous and will help us to propagate that message. We are partnering with him and we intend to roll that out. We are also looking to see how we can focus on the youth, because that is another area that we haven't really done much to generate. So we've just brought somebody on board now to help us to have youth messages that will talk to our Gen Zs and our millennials, because some of them have earning power. They'll be able to buy that, and they can also advocate to their parents to come on board and support us. We're also looking to expand laboratory services, because we know that it is not all of our hospitals that have some of the tests that we need, and people now need to. So we will have a hub of that, just like we have for the drugs. That is something that we are bringing on board next year. We're also looking to see, if possible, how we can expand our benefit package further more people that come on board, we are able to add on other services. One of the major things we are working on is to institutionalize our sustainability components for the vulnerable.
The Lagos State Health Management Agency now boasts of over 1.3 million residents on the Ilera-Eko health plan, alongside the rollout of an equitable fund that guarantees access to healthcare services for over 300,000 vulnerable residents in Lagos. And more people are welcome on board.